afternoon, Sandy.
Hello.
Thanks very much for agreeing to do a piece to camera for our conference, given the unfortunate sort of coincidence that the National HIA conference clashes with the ADASS conference.
I'm really delighted that you've taken the trouble to get a piece. ADASS is a very strong supporter of HIA agencies, and so really delighted to be able to contribute even from a distance. So thank you.
I'm interested to know what you feel about the term closer integration with housing, health and care. And I guess our audience in the HIA community would be wanting to know what that means practically. What would be seen by the member of the public, the vulnerable person in their home? How would politicians see it? And I guess what I'm interested in is what impact this will have on commissioning and subsequent supplier contract arrangements.
If I start with what people will see in a closer integration of housing, health and care services, I think the answer that we're all searching for is that people will see a seamless response to their care need, whatever it is. And we all know, those of us who've been in the business a long time, that housing is an integral part of somebody's care, because being able to live independently at home is critical and crucial to the care that they're able to enjoy and the independence that they're able to enjoy. So I would certainly see that the bill gives an opportunity and a restatement of housing, care and health to come together. We know that we should always have been doing that, and so what we've got to make sure that this bill and the subsequent act helps us to do is to really make it a reality this time. And I think one of the critical things is bringing health and care together enables health to have a better understanding of the importance of housing and the importance of investing in options to help prevention and to help people to stay at home for longer. So really the commissioning question is a really important one, because what we want to do is bring health and care commissioning together, which includes housing as well. And there may well be opportunities in the future for single contract management. Indeed, in a lot of places that already happens. And so what we want to do is see the best everywhere. And certainly politicians being able to see that their pound is being used in the very best way across all the three major players in helping people to live at home successfully.
Okay, can I ask, what extra impact do you think the care bill will make for Leeds and more widely once it goes onto the statute book? For example, are we likely to see a radical shift towards greater use of self-assessment?
Well, to answer the first question about the impact, it is going to be huge, because what we're going to see is a much wider entitlement for people to come into the purview, if you like, of the care agencies. So many more people who are currently self-funding now coming into the horizon, if you like, of the statutory agencies, helping to assess their needs and also assess how much financial support people may be able to anticipate, and also providing advice and guidance about financial circumstances as well as care circumstances. So it's about bringing those together. I'm quite sure that because this is a huge new duty for local authorities, at a time when funding is very, very tight, the tightest ever, that we will see new and innovative ways of engaging the public with their care arrangements. And part of that might be around self-assessments, whatever that might mean. Some of it might be around local authorities delegating their responsibilities in terms of other agencies helping people in terms of assessment. But whatever happens, what we will need to see is individuals, whether they're existing self-funders or people who need support from the public purse now, that we need people to be more in charge of their own arrangements, to, if you like, self-manage and self-care. find out the things that they can do to make their lives easier and make their lives a better quality of life, because we know that with the amount of money available, with the new duties and responsibilities, the way that the Care Bill will be successfully implemented is alongside citizens, seeing what their role is in terms of seeing the benefits and the assets that they bring, as well as partners and the public purse supporting people in the very best way that we can.
Are there any parts of the bill which you think will be especially challenging, and indeed elements where you think HIAs have got a greater role to play? I'm thinking particularly around the provision of information and advice, not just simple signposting.
Well, certainly the big challenges in the bill, as I've already mentioned, is about the funding of it. And none of us are completely sure that the anticipated impact assessment and the amount of money that's available to us is actually going to be enough. Which does mean that when we're looking at things like information and advice alongside every other part of the bill, that we need to make sure that we're implementing it in the very best way. And information and advice is a really good question, because there will be some evaluation that's needed about whether we want a small number of very big providers to provide information and advice to people, which would be more than signposting, or whether we want lots of providers who can provide help at that earlier level. And I think that the jury's still out on that, and we're still discussing it at both national level and also in localities. The new duties will require us to ensure that people have information about their care entitlement, but also their funding entitlement. Some authorities I know are beginning to look at whether that's a new sort of service that we should be commissioning, because it's about bringing finance and care together in a way that probably we haven't done before. Others, I think, are still thinking it through, and indeed there's some national work going on with the Care Bill implementation teams, thinking about whether there are some national products, because of course many people now are using the web and the internet, and it could be that the Department of Health might commission some national work. Whatever happens, we need to be making sure that people at an individual level know that they can get individual help. And so that probably will mean that HIAs will have some involvement, because they're in touch with a lot of people, and we want to make sure that they know where to get the best help. But it doesn't necessarily mean that they would automatically be considered as a major provider. I think it will depend. Partly it will depend on what's happening nationally, partly it will depend on what's already in existence locally. So, for example, I'd just like to do a quick plug for Leeds. I know I'm here for ADASS, but a quick plug for Leeds. We do have an electronic directory of services that our local care and repair service manage on our behalf. The fabulous thing about that is that now that we're working much more closely with the health service, the GPs absolutely love it, and they want to extend it and extend its reach. And so that you could see that might become something that would be a health, housing and care resource for the city. Now, whatever's available nationally, we would be foolish to be losing that. We want to build and develop that. And my guess is that all sorts of different localities will be having those sorts of considerations as they go forward. So the one thing we do want to make sure that we do together is that we actually and actively provide the right sort of information for the public so that they can get help when they need it most. And we know that we don't always succeed in that very well at the moment, so we want to continue to improve.
In these very tough times of economic uncertainty, when money's tight, what aspects of an HIA service are more resonant with commissioners and funders?
The sorts of services that we know we can invest in and save money elsewhere in the system. So, we've mentioned a lot of the sorts of services that HIAs already are part of. What local authorities and health service and everybody else is looking for these days is to say, right, how can we invest in services that will save money elsewhere? Now, that's a big problem in some ways, because preventative services, we know that there's probably not enough evidence that really can release cash to say, well, if you spend it on this, you don't have to spend it on that. But I think there is a growing body of knowledge being developed around early intervention and support, and more importantly, for people who are housebound and on their own, completely isolated, the sort of friendly faces, the sort of using volunteer capacity that may well not need the intensive intervention from a statutory agency. Those are the sorts of things that build confidence in people and help them to know where to get help. So I hope it's not repetitive, and I know it's not easy. This isn't going to be easy for any of us. Many local authorities are already having to cut back and use money differently. But some agencies, we know, for example, libraries are always around, sports centres, linking in with community-based activities that isn't the more traditional local authority services. It's about broadening the vision and perspective about how helping somebody in their own home, in the community, can help. And it's those sorts of things that increasingly local authorities will want to invest in when they can see them being effective.
Sandie, thanks very much for your time today.
It's been a pleasure. Thank you very much.